right, good morning, everybody. Can you all hear me?
Yes.
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 Perfect.
Yes.
Yes.
I can hear everybody too, so that works well. All right, well, we'll wait just a couple minutes to let folks come in and then we'll get started. All right, good morning, everybody. I'm going to go ahead and kick us off. I appreciate everyone jumping online. I apologize for the late notice on the virtual meeting, but we have a relatively short agenda today and wanted to make sure that not everybody just drove all the way around the region to meet us. But I appreciate everybody jumping on, and we'll go ahead and get started. If I can get the slides. And can I just get a quick thumbs up from those online that the slides are showing? Thanks, Ed. All right, so today we'll go through some welcome and introductions, talk about what we did in our previous meeting, which was in May, and then talk a little bit about some of the survey results that we've gotten so far, as well as the subsequent public meeting that we had in White House. Some next steps, and then we'll get you all out of here. So in the last meeting, we presented some of the preliminary results of the first survey. Emery, could you mute? Presented some of the first results of the first public survey. We talked about some of the future events and upcoming opportunities to disseminate the survey. And we discussed some of the information that's needed from providers, drivers. We had a really good discussion with you all about some of the issues providing service, as well as dealing with some of the challenges of expanding service and as well as reaching different audiences. So I'll kick it to Shay to talk a little bit about summary of our community engagement to date.
Thanks, Daniel. So just as an overview, the 3 outreach events we've done so far have been Clarksville, Lebanon, and White House. The numbers that you see on the screen are the number of participants in our survey that were collected during those events. So you see 43, 36, and 22. So you can see out of the total number of 164 survey responses that were received as of 7/15, that the majority have been at our events. And seeing that a lot of the responses have been at our events, we also know, recognize, and we'll talk further throughout this meeting that we have more work to do to reach our region further. So this is just a little bit of an overview of where our participants live. So you can see the colors of the pins are based off of which public meeting that they attended, but you kind of just get a visual representation largely from the counties and surrounding counties of where those public meetings have been so far. So kind of as you can see on the map, we are still looking to do further outreach in the southern and western part of our region. So just a little bit of an overview of our survey results. Before we get into the actual data that we found in the survey, we just want to provide some context of what we're seeing. So one of the first questions on the survey is asking, if they're able to drive to most places. So 25% of respondents are unable to drive alone. When we got to the public meetings and started having discussions with people, we realized that sometimes that question wasn't always able to capture all of the challenges that somebody might be experiencing, because somebody might initially answer like, yes, I'm able to get to most places, but then further discussion and thinking through some of those things logistically, people sometimes realize that there were more challenges than maybe they had initially thought. So there were still limitations on, where someone might be able to go. For instance, they might have said, I'm able to drive within my town or community, but if I'm driving to another county, then I need to make a plan. So just kind of an example of what we found from the data of the surveys, and then the anecdotal conversations, we're able to kind of get a better idea of people's experiences. There has been some, limitations in the way that our survey was designed in getting some more of that comprehensive data just by way of the drop-down nature of the survey. So when we look at the subsequent survey results, it is, though the people who answered that they were not able to get to most places were prompted with the additional set of questions. So when we get into the results, it's indicated by the 34 responses of that question. And then our community events has helped fill in the gaps from the survey to learn more about people's experiences beyond those questions. So I'm going to pass it over to Debelina to get more into the data.
Thank you, Shay. So out of those 25% who are not able to drive on their own, so when we ask that what are the main limitations or barriers for them to drive, it came out that 68% have a mental or physical or some emotional condition which limits their ability to drive. 38% do not have an access to personal vehicle. And 38% again cannot afford to cost of a personal vehicle, and the rest 18% they do not have a valid driver's license. So these are the information we collected from the survey. Then when we ask that, okay, if they need to again go out for their personal reasons, so what are those reasons? What are the most visited places they go, and what are the transportation challenges faced when they visit those places? So it came out from the survey that most of them are going to the doctor's visit or the medical visit for their healthcare reasons, and there they are having most of the time some challenges because they need to schedule the ride. And after the medical visit, then comes for shopping or running errands. They to run their errands or going for a grocery shopping. Again, they are having those challenges for most of the times or sometimes. That is also because these places like the doctor visit or shopping or running errands, these are the dispersed or erratic location. So whenever they need to get out of the county or so, that time they are facing these challenges. But if you see that if they are traveling to school or for some office work, then generally these percentages lowering down, because obviously these places are at a concentrated place or at a fixed location. So this is the result we are getting from the survey. So the people, when they generally don't drive, when we ask that, then how do you get around in the community? So the answer came that mostly they rely on their family or household member or some friends. Like 68% get a ride from their household member, from their daughter or their son or husband, or mostly they're from their spouses. And somewhere they rely on the public transportation. Like if you see, 24% generally they schedule a ride from a public transportation provider. And then some rely on the private services, like 18% schedule a ride from a medical provider, and 12% use a ride share service. And the rest, like 21%, they generally like walk or roll or bike. So when we asked that, are you aware or do you have any kind of transportation providers information, and do you really ever use the services? Then mostly the answer came no, because and that is also because we generally did not have these public outreach event at the most of these places where these services are actually there. But whatever, in our three locations, when we had this public outreach, most of those people came out with the answer that yes, they know about the Mid Cumberland Human Resource Agencies and We Go Access. So that's why you see that for these two category, people mostly answered yes. They already have heard about these agencies, or sometimes they also used these their services. But if we go further, then mostly the answer came no. They do not have any information or awareness about these kind of services.
So we did our public outreach events. We had a lot of opportunities for conversations at our different stations. And so what we have here is a word cloud to articulate some of what we heard at the station, where people were asked, what are the biggest challenges to accessing transportation? And for context of when we look at these answers, a lot of the people that we were talking to were people who are using on-demand or paratransit services. And so what we saw most frequently was scheduled and flexibility of scheduling and the hours. And, there were some other answers, like with driving, talking about traffic and the cost of the bus services and things like that, stairs and access issues to access the services, various transit. So these were some of the answers that we saw when talking to people in person. And then next we have people's positive experiences and new ideas. Again, these are things that we've talked about at previous steering committee meetings, but we got a lot of really positive feedback that people had really great experiences with the drivers of these services, and had good scheduling communication experiences. They thought the cost was affordable, and then just some more ideas that people saw. They would like to see more options in rural places. They would like to see more transit options, and things of that nature. So that is kind of what we learned when we're talking to people. And we also have all of this information in other formats too, but just kind of wanted to give you all a little bit of a snapshot into some of those conversations we had in those meetings. And so lastly, it's just a little bit of the demographic data that was collected through the survey. This is showing who we've heard from so far. So looking at this data, we know there are gaps that we would like to more fully encapsulate our communities in our region. So I want to ask a question first about, suggestions of how we think that we can reach other people that are underrepresented in this data. But before I do that, we just went through a lot of information. So I think before we kind of get into that question, just want to pause and see if there are any reactions from anything that was presented or any questions or clarifying questions that people had about what we've discussed so far.
Yeah, this is Ed. Can you all hear me?
Yep.
Yes.
Yeah, I have a question. I think I have understood this right. Of the 164 survey responses, did you say that most of those would have been gathered at the public meetings as opposed to being distributed throughout the region?
So, yeah, so great question. So where we've so far gotten responses has been at the public meetings, but we have been distributing these surveys to senior centers and at events. And we actually just got our first batch of surveys back from one of the senior centers. So we are actively collecting more of those surveys of ones that we've distributed. But yes, out of the ones that have been kind of tabulated so far, those have been mostly captured at events.
And Shay, I will also note that we have been sharing the survey through our social media accounts.
Yeah.
Well, this is Ed again. I guess what that suggests is that there may be a bias in these responses in that each of the or most of the respondents took the initiative to come to the meeting. So they were acting in some fashion on their situation, which suggests that there's a whole great population out there that we haven't yet heard from that have not taken any steps, certainly not coming to one of the public meetings. So I think that's something that we can talk about making sure that we take steps to reach those that haven't come to these meetings or would come to future meetings.
Yeah, and I think that's a great point, Ed, and that's probably the sub question of what we have on the screen, which is how do we reach folks that aren't able to come to public events and or haven't heard about the survey or are having trouble accessing it? Because a lot of our outreach has been focused on reaching senior centers and reaching other community places, but for folks that can't even get there, because I think one of the main takeaways that we had at each of the senior centers was that folks weren't really having that much trouble getting to the senior centers. It was other trips that were either outside of the county or in more difficult locations to get to, or in an area where transportation providers didn't serve. So I think that's a good point. So does anyone on the steering committee have ideas or maybe previous activities that you've gone through where you've had success reaching folks that didn't actually use transit yet, bringing folks into a new service?
Well, I'll be glad to speak one more time. I think this suggests that we at least consider the possibility of mailing survey instruments to people. That can be expensive, but there may be ways we can seek funding. But I'm just thinking of existing mailing lists, whether they're senior centers or AARP or Senior Ride Nashville or whatever. If there was a way we could get the survey in the hands of people whose addresses we have, it would be far more expensive to try to get it into the hands of a normal distribution of that aging population, of course. But I think somehow to get this out there in a way that's not dependent upon coming to something could give us a pretty good indication or a better indication of what issues people are facing.
Absolutely. And I think that's an ongoing conversation of how do we reach those people. We have looked at, online versions like social media and email, but of course we know that not everybody in the populations we're looking to reach are going to have access to computer or feel comfortable accessing computer. So we've really looked at what options can we do to send out paper versions as well. And I think just getting ways to get those surveys back and doing that is kind of our ongoing conversation.
Mike, I saw you were trying to say something.
Yeah, I've done mailings in the past, and the last time I did a mailing was a few years ago at a different transit. It cost me $20,000 for the mailings, and I got less than 200 surveys back. So I won't do, I won't do mailing surveys again because you don't yield the results, but it's always worth a try. But I know in the past it's not been, these were not just transit riders, it was everybody in the county is what I did. And we got less than 200 back out of a whole county load of people. So that can be a challenge because if they get the survey, most of the time people throw them away, don't even look at them.
Right.
That's just been my experience.
Well, and I'll say from our perspective, the most successful we've been is when we take surveys with folks. Like we are actually the ones notating the answers, and we're actually having a more developed and comprehensive conversation with them. And I will say that not only was it easier for them to take the survey, but we got a lot, more detailed answers as well.
We've done it both ways also. We've done it where we've had survey people on the buses and help them with the surveys. Then we just hand them surveys. And when you hand them the surveys, they just throw them on the bus seats and you got to pick them up. But if you have somebody there ask them the questions, that gets more results. But it's going to be the population of folks that are already riding. It's going to be the people, how do you get that are not riding, that have never ridden before and don't understand what we do for a living because they have 3 cars in the driveway, but whatever it may be. But I just know that mailing surveys is expensive and it's a challenge to get them to come back.
Right. I see Felix, your hand is up.
Yeah, thanks. I was just gonna say that I think we all work with different organizations that cater to different groups. If we can all just maybe provide a list of who those are that, may be helpful. I would say noticing that, the 85% white, 92% not Hispanic or Latino. I was gonna bring up whether we have, I can't remember if we have the survey translated. But there's organizations that we work with that I'm sure if we had that available, they can help us distribute and try to get a better reach.
If we were to drop off a number of copies, translated and also English to, pretty much all of you, would it be possible for you to distribute at least to the folks that are easiest to distribute to, and then potentially, get them back to us?
Yeah, I think we can, reach out to some of those organizations that are partner um, organizations that we work with and ask them if they can help us distribute and collect any answers.
Okay.
So yeah, we'd be happy to do that.
Paula, I see your hand.
I was just going to suggest maybe the public library staffs having us a couple of copies. And in terms of the not his, getting in the minority groups, I would say, talking to someone at Connexion and some of those groups to see if they'd be willing to have surveys or ask people questions for us. I think that would be beneficial as well.
Okay.
And also the home delivered meals programs, if there's, I don't know how they work in all the counties, but if maybe somebody could get some opinions from them. Those are folks that are typically homebound and not using transportation. But if we're wanting folks to just see like regular folk, older adults who drive, I think the libraries, and if we could somehow get into some of the faith communities, which is always a challenge, but those are opportunities for reaching people who don't necessarily use transit currently.
Right. Those are good points. Thank you. Any other ideas?
This is Carrie Brumfield with Senior Ride Nashville. Our experience with physical surveys has been, we've had a better response because we do have a smaller pool that are, it's very targeted pool of people. But I would say that's the primary way that we are communicating with the members of our program is through the USPS. And for our surveys, we typically have about, a 50% return rate on those. So I don't know if there is an option to kind of narrow a distribution list to a more targeted list. If I don't know how feasible that is, but I had another thought and I lost it. I will try to find it again. I'll come back.
That's okay. No, I appreciate that remark, and I'm glad that you're getting, 50% response. So we'll think through that list, and I think these are all really good ideas. We'll also get the survey translated as well, and we'll come back with a more viable solution. But I appreciate all those. Go ahead,
Daniel,
Paula.
this is Paul again. Another thought I just had, I've had great success in doing activities with the YMCA, and they have a very diverse set of people who come to the different Ys, age-wise, ethnicity, everything. So they may be a potential place to reach out to, because they are not just Davidson County. They're in, Springfield, Clarksville, Murfreesboro, Smyrna. So that might be a group we could reach out to for assistance as well.
Right. Good idea.
And Daniel, sorry, this is Carrie again. One more idea to explore, maybe the 211 call center.
Mhm.
I wonder if they would be, if there's any arrangement or partnership that could be had with United Way and 211 where they could facilitate, asking of these questions to older callers that are calling for other services.
We can reach out to our aging staff,
We-
and make sure that they're included.
We've
and that-
partnered with them in the past in the aging department for outreach events, so we can definitely, that's a good idea. We can reach out.
Do we have a contact at the VA hospital? I know there's a lot of people from across the region that go to their services. Figured, that may be a good point to try to understand what some of the challenges are.
Mhm.
That's a good idea too.
Any others? All right, well, we'll move through. So some key takeaways that we've heard so far. This is sort of a combination between the more qualitative questions in the survey that are more open-ended, as well as conversations that we've had at each public meeting and at each station. So on some of the stickers that we asked folks to write on, as well as on some of the boards. So 41% of respondents are older adults, so we're clearly reaching a good subset of one of our target populations. The majority of respondents can drive themselves, but again, I think a key takeaway from our conversations was that they may be able to drive themselves to a limited number of locations, but once you dive deeper into some of their potential limitations, they might not be able to leave the county. They might not be able to access certain medical visits without scheduling a ride or having a friend to drive them. The majority of respondents who do not drive have a mental or physical disability. Medical visits are the most frequent trip type, so clearly essential services are at the top of the list in terms of where folks need to go. And then the majority of respondents need help from friends or family members to get around the community. I think that was a conversation, at least I had with most people, even if they weren't, even if they were able to drive themselves, they were most likely helping out a friend or family member getting where they need to go. And I heard many folks talk about how once they get to a point where they can't drive, they're not really sure what their options are. So definitely an issue with information sharing that we're hearing. But then I think more importantly for this group, the provider feedback that we've heard, this is all pretty qualitative and based on those conversations. But just wanted to put this out there and see what responses were. So non-recurring trips seem like the most unreliable and difficult to schedule. Folks that are going to the senior centers every day, for the most part, we heard are very successful trips. They get there using CHRA, they get there using Clarksville Transit or WeGo, and are having a pretty easy time scheduling those and getting there on time. But once once you get into non-recurring trips, like trips to the VA or trips to a different county, that's when folks are having issues either scheduling it or we're hearing about issues with pickup as well, just a timing issue. There's also significant demand for service expansion. We heard this specifically in Wilson County in Lebanon, talking about expansion on Wilson rides and other volunteer services, basically saying, well, they don't go all the way to the VA, but if we just had, and we heard this from Gail Wilson, who runs Wilson Rides, if there were just a little bit more money to provide a couple more drivers that went to the VA a couple times a week, then they would be able to expand that service to folks. And then cost per service is too high, both fixed route and on demand. We heard lots of requests for either subsidized or free transit. And then majority of people desire a balanced set of options. So people don't always want to rely on demand. They might want to also take transit or ride with friends or be able to walk places and be more independent. And then finally, timing and wait times are our most frequent issue with on-demand service. So I don't know if folks have specific reactions to that. I know we've had some of these conversations before, but just because those weren't specific questions within the survey, we wanted to provide that as well.
Can you,
Nice.
can you repeat what you said about people not wanting to wait on demand? Did I hear that right?
It was mostly what we heard were pickups. So folks were getting where they need to go using on-demand service,
Okay.
Reliably, but then we're waiting on pickup either, an hour or 2 hours past when they were supposed to be picked up.
Yeah, and we heard that feedback specifically with caretakers of an adult day center, of like knowing, when the ride will be there so that they can plan when to help them get out to the ride, and then just generally as well.
So is that more for like paratransit services?
Yeah.
Yes.
Yes.
Okay.
So I guess for the providers on the call, is this all feedback that you've heard before? Maybe is some of it new, or is this sort of typically what you hear from riders when you do your own outreach?
Sounds right to me.
Yeah, sounds right to me too.
Okay.
One of the programs that we implemented because of that is access on demand that allows riders to book their trips within 2 hours rather than 24 hours in advance,
Mm-hmm.
because precisely some of those issues as well.
Hold on, we're having a technical difficulty. Anybody know where that's coming from?
Must be coming from somebody's unmuted.
Someone's probably trying to.
It's pretty tech, what we're hearing. I think you need to repeat yourself. You came through pretty jarbled. I can't speak. Garbled.
Whoever just spoke, if you could repeat yourself, I couldn't tell who it was, but it was coming through kind of faint.
Yeah, I think Stanton's the only one unmuted.
Yeah, but I don't think he's the one speaking.
Mm-mm.
No.
Like, mm-mm.
I think it resolved itself.
Okay, well, Sorry, Felix, what were you saying? I'm sorry, I forgot.
No, I was just saying that these issues are familiar. It's feedback we've heard before, and precisely because of access riders not wanting to, you know, the difficulty with scheduling trips or waiting for the rides, we implemented the access on demand where they can book their trips within 2 hours, just so they have a little bit, if something's more on the spur of the moment, they have more that as an option. And we've been also looking at ways to implement accessibility and incentivize people to use the fixed route, to those that are able to. Some cannot, but there's some that may, fixed route may be an option. So looking for ways that how we can improve that accessibility factor so they can consider using fixed route when it's a better alternative maybe than booking an access trip.
Right. Felix, since your service is entirely operated within, at least for Access Ride, within Davidson County, are there certain trips that are more difficult to provide than others? Or because, the service is pretty routine, is it, do you find that it works pretty well no matter what the trip type?
Oh, I'm sure there are, but I'm not familiar with the details, but I can check with our Access Ride group and see if they have any feedback on that.
Okay, thank you.
I can speak to that. I think you're going to find that, it's a time frame issue, just like any other transit. You have certain time frames where it's just sold out. And it's usually going to be, early morning and, mid-morning, and then it'll pick up again, just like a regular fixed route would too. Also, that your peak times is when you really, fill up, and people. It corresponds with traffic too, right? So when you get a lot of the issues of, having to wait to get picked up and things like that, it all just starts to make sense because the majority of the rides are going in the peak times, and you're also dealing with school traffic, regular commute traffic, things like that. So,
Right.
My personal opinion, and I don't know if you can add to the survey, is that, I think the answer to so many of these issues is really to, go with the demand response models that allow people to, use their smartphones and help try to take care of some of these areas, and provide kind of a different model that allow us to get drivers and also people get access without having to have the same model of full dispatch and scheduling, let the technology do the scheduling, let the people have the access. It's been proven, through the success of Uber and Lyfts. And I think that the model that we should be looking at would be, how do we incorporate that kind of technology, even with seniors, in both rural areas and in areas that, have transit in an urban environment, but people I think they just enjoy it more. And I just think that's a solution we should be looking at aggressively.
Right. I agree with you. Okay. Any other reactions to our provider feedback? All right. Well, I'll move to close it out. We kind of already went over these questions, so I'll skip these, but we know that more outreach is needed. If you have any additional feedback on what we've presented thus far, please get that to us by August 1st. We're in the process of scheduling 2 more public meetings in some of the areas of the region that we haven't reached yet. So look out for more information on that, as well as information on a provider interview that we'll be conducting one-on-one with each of the providers. We're finalizing those questions, so look out for that as well in the next month or so. And then our next steering committee meeting will be on August 20th. And we'll start getting into, some of the more implementation and recommendation type information that we have for you all. So I appreciate everyone's attendance today and feedback. It's really helpful for us as we get through the development process of this plan. But unless anyone has any additional questions, I think that's really all we've got for you today. And we appreciate your help.
Daniel, I don't have any questions, but I do have a share, if I may. Senior
Sure.
Ride Nashville is currently today through Thursday. We are launching our Driven by Giving annual fundraising campaign. This is the first annual campaign. We have an ambitious goal of raising $25,000. And so I invite anybody that may be interested in sharing our posts to go to Facebook, search for Senior Ride Nashville. Of course, I'm happy to share information, but we would really appreciate any help spreading the word for this campaign.
Sure, no problem. If you could send me just a blurb about that, I can include it in our follow-up email
That would be wonderful.
as well. Thanks.
Thank you.
Anyone else? All right, well, thank you all. We'll communicate with more information as we have it. And everyone have a great rest of your week.
Thank you.
Thank you.